And welcome back as we mark the one-year anniversary of the pandemic. It is safe to say none of us realized just how deeply our state would be affected.
That's for sure. Dr. McGeorge, you've been on the front lines of this fight from the very beginning. What are your thoughts as you look back on this past year?
Wow, Kim and Devin. Yeah, you know, the discovery of cases in Michigan changed our lives essentially overnight. For me, the early weeks were a blur of shock, exhaustion, and frankly, a growing concern about the severity of the situation.
Beginning tonight with that breaking news on the coronavirus outbreak, Governor Gretchen Whitmer declaring a state of emergency in Michigan after announcing there are now the 2 first confirmed cases of the virus in our state.
And just like that, the dominoes fell.
The coronavirus pandemic sparking sweeping cancellations of sporting events, schools, and major public events. People being urged to stay home in hopes of slowing the spread.
Closures helped in some parts of the state, but here in southeast Michigan, our die had been cast. Community spread was already happening.
Today, our Dr. Frank McGeorge warned this is going to get worse before it gets better.
As an emergency physician at Henry Ford Hospital in Detroit, I was at ground zero shortly after the first cases were confirmed. I took care of a man that I was certain had COVID. He died in the hospital within a few days.
Working midnights in the ER this weekend was already very different from the weekend before.
Because of my constant exposure, we decided I would broadcast from home. I haven't been live in the studio since. A good decision as things worsened in the hospital.
Make no mistake, Michigan has been hit hard.
Over the first several weeks, many people I worked with became sick and tested positive. I developed a fever one day on top of a long-standing cough. Fortunately, my COVID test was negative. PPE became a precious resource. After I did a story about the CDC recommending doctors turn to bandanas when PPE ran short,
this is really sad.
I had a surreal moment of Twitter notoriety when Snoop Dogg retweeted the photo. Looking back, one of our biggest misjudgments was in the amount of asymptomatic spread. That meant our early testing was tragically inadequate.
The bottom line is not everyone needs to be nor will be tested.
Yeah.
Our underestimate of asymptomatic spread is also what produced my greatest regret as a first informer. It took us over 3 weeks to encourage broad mask use.
Now, to be fair, masks were in limited supply at the start of all of this, but the CDC's early statement that they weren't helpful was just wrong. It didn't sit well with me then, and looking back, if I could change something, it would be to recommend masks much sooner.
You know, the world, Frank, has been through this collective trauma. I guess I'm wondering if you've thought about the positive lessons we can take away from what we've all been through.
Well, you know, I think there are a lot of them, but going forward, I think the big one is, as a global community, we need to take public health and preparedness more seriously. You know, SARS and Ebola set some of the groundwork, but clearly this isn't a problem for any single nation. It's a problem for the entire human race. Now, looking at the question on sort of a more personal level, I want to point out simple stuff like masks, distancing, and hand hygiene, it has eliminated the flu this year. So even when things do return to normal, I actually hope that we'll remember some of the ways to slow all infections in the future.
And the future is such a key thinking point here because, Doc, we've become such a connected world. It's hard for me to imagine that we're done with pandemics or done with similar problems, right?
Well, absolutely. You know, this was supposed to be a once in 100-year event. Maybe it will turn out to be that way, but I suspect with our connectedness, it'll probably happen again in our lifetimes.
Yeah, so right. All right, Doc, now like you, there are so many frontline heroes in our community, and those are the men and women who risk their own lives day by day to care for sick patients.
One Beaumont nurse captured national attention in the early days of the pandemic.
Nursing is it's a calling. And so is being a mom. And every day I wake up and I try to remember what I'm grateful for. And even though every day, at the end of the day, these days, I end up in tears, I hold on to that gratitude and I hold on to that love and I hold on to my teammates. And you just keep pushing forward.
That was Maureen Grecius last April on MSNBC. She works at Beaumont Hospital, Farmington Hills. She shared the toll on medical staff during the first surge and how heartbreaking it was to watch patients get sick and die without loved ones there. We caught up with her this week. She says they've learned a lot about how to treat COVID-19 and care for their own emotional and physical wellness.
that I'm so proud to be a part of the nursing profession. I'm so proud of what we did last year and what we've continued to do, regardless of how hard it was and whether or not I ever imagined that I would face this when I became a nurse. I don't regret one moment of taking care of patients in the middle of a pandemic. Those people needed nurses because nurses are incredible. And they needed physicians and respiratory care techs and nursing assistants and all of the people in the hospital because we're incredible.
Incredible indeed. Thank you to all of our frontline workers through this pandemic.
You know, this virus reacts so differently in people, right, Doc?
Yeah, you know, some are asymptomatic while others suffer very serious life-threatening symptoms.
Our Paula Tutman checks back in with a paramedic who is still recovering from COVID-19 and how he's grateful for each and every day.
Live, laugh, love, strive, triumph. A year later and still fighting long hauler syndrome, these are some of the most important words in Avery and Juliana's vocabulary. Today is a good day for Avery Garcia because it's another day he can say he cheated death. One of the early cases in March 2020 as an EMS worker, he was in the back of his rig attending a patient dying from COVID. And less than 2 weeks later, he was the patient who was dying. 3 months unconscious at Beaumont Hospital, he married Juliana outside the ICU that saved him. And every day since has been a struggle when he sees and hears of people who still choose to deny the seriousness of this virus.
Why is it even a question? Should you help people? Should you go out of your way to make sure they're safe? And that should never be a question. It should be automatic.
That's intensely frustrating and very demoralizing. To see someone stamp their feet and whine and make a big fuss, you think, are you a child? Grow up. We have to take care of each other. We don't have anything else.
A struggle to sleep because of the PTSD embedded by the illness. He can't really remember, but still dreams.
I'll be laying awake at night and I'll just feel like everything is vibrating for no reason. I know that I'm still, I know I'm not moving, and yet the whole existence around me feels like it's vibrating. There's times where I'll get random cramps in weird places. There's, times where I will wake up gasping in the middle of the night and I don't know why. There's times where I'll just suddenly lose my balance or I'll randomly drop something. And I'm sorry about your Coke glasses, by the way.
And yet a year later, he is incredibly hopeful. He and Juliana anxiously await the buds to return to the trees because he missed them last spring. He's looking forward to the day he can climb those stairs without gasping for air. He's hopeful one day he will return to saving lives instead of continuing to fight for his own. He's hopeful the man he was before COVID-19 will somehow find him again. And he is hopeful for others still surviving COVID.
The live, laugh, love. For my wife, Juliana, and for myself, we added a fourth word: strive. You always keep pushing. Okay, maybe I'll never get it back. Doesn't mean I'm never going to keep trying.
Every day is, a triumph for not just for Avery and for myself, but for all of the people who helped him get to this point. Those people are still working as hard as they can. They still have bad days. The people who have lost family members, they have bad days. But we're still all here and we can recognize that. And really, the only word that comes to me is triumph. We're still here and it's a triumph.
Live, laugh, love, strive, triumph. Words we can all use as we get through this. Thank you so much, Paula.
It came out in abundance in the early days of the pandemic, and that was a rash of kindness. Our Steve Garagiola shows us one act of kindness that is still going strong nearly a year later.
And making it a memorable year for students despite COVID-19, how one teacher is trying to do just that, online and in person.
I will forever keep this memory of what the city has done to commemorate the lives of all of these people that are here, and just to have my husband amongst the people that were affected. It's just remarkable to see the city recognize all of them and the impact that they've made, and not only in our lives, but into the lives of our communities.